Hi everyone, it's me Zana, back with my second part of my blog. I'm really sorry that it's taken me so long to record the update video. It's been over a year now since my last surgery. I don't really know why it's taken me so long. I think part of me just felt that if I posted a video and said, oh yeah, everything's okay now, that something bad would happen, which is silly, I know, but I don't know, I just didn't want to jinx it. However, like I said, it's been over a year now, so I think it's time to post the update video. What prompted me as well was I received a notification yesterday that I had a comment on my first video, and I found out that there was actually other comments on there which I didn't actually even know about, so I'm really sorry that I think one of them was 8 months ago. I don't know why I didn't receive a notification. I didn't even realise how many views was actually on the video. So thank you for your comments, and like I said in my previous video, if you have any questions at any time, whether it is in years to come, please comment, and it might take me months to get back to you if I don't realise, but I will always reply. So to continue where I guess I left my other video, was where the bone infection doctor and the surgeons basically couldn't agree on what next step to take. So that actually was still the case really on the day of my surgery. They told me that they didn't really know what they were going to do or what they were going to find, so it all depended on when I actually went down into theatre how they were going to proceed. So they basically said, we'll book you a big enough slot so that if we do have to take all the metalwork out of your spine, then we can do that. So they had to give me obviously a lot more anaesthetic as well to make sure that I wouldn't wake up if that was the case. That was quite daunting, I suppose, not knowing, am I going to wake up and all the metalwork's going to be taken out, or, you know, are they just going to wash it? And I think that was also really hard for my parents, and Harry, my boyfriend, who came along with them that day. They just didn't know what to expect, how long I was going to be in theatre, and all things like that. To be honest with you, it's all a bit of a blur, the whole sort of periods that I was in hospital, so apologies if I miss things out and then come back to them at a later date, because I can't really remember a lot. I don't know if it's just because of the medication that I was on, or I don't know, that I've just maybe blocked it out. I'm quite good at doing that, so that might be the case. But anyway, I was admitted to the ward at the Royal National Orthopaedic in Stanmore, which is where I had my initial surgery back in 2010. It was with a different surgeon. Previously I had Mr. Nordine, who, like I say in my first video, has now semi-retired, although he was actually really involved in the discussions and meetings that all the surgeons and bone infection doctors had about me. But my surgeon was going to be Mr. Bagawati, who was really good, really understood where I was coming from. And when I had a bit of a breakdown in his office, when he said, oh yeah, it might be a few months until you have your operation, he managed to squeeze me in a lot earlier, because I think he realised that by that point I couldn't go on any longer, because it had been over a year, because obviously I found this lump May 2016, and then by then it was about July 2017, so over a year of not knowing what was going to happen. So anyway, I was admitted to Margaret Hart ward beginning of August. I can't actually remember the date now. All I know is that I was actually still in hospital for Harry's birthday, and he had to come up and spend his birthday with me in hospital instead. And when I first walked into that ward, it was actually quite scary. It looked like something out of like Call the Midwife. It was really old-fashioned, really big. There were so many people in there, and it actually really scared me. It made me just feel, I don't know, just really worried. It was very clean. It's always been clean there, which is obviously a massive concern for me. Obviously, where I have got an infection, or had an infection in my spine, cleanliness was obviously like top priority. But anyway, so I went down to theatre, like I said, beginning of August sometime. And they sort of said to my parents, oh yeah, if it's just that we're washing out the metalwork, then it'll probably only take about an hour and a half. Well, I was actually in surgery about 3.5 hours. So you can imagine my family were just thinking, oh my God, what's happened? Has she got all the metalwork taken out? You know, so on. And I remember as I came round, the first thing I asked the lady in the recovery room, it's all a bit of a blur, I can't actually even picture her face, but I remember just asking, did they take it out? Did they take it out? And anyway, they didn't. So I had this huge sense of relief of, oh, I can still wiggle my toes and they haven't taken any metalwork out. It must have been okay. It couldn't have been bad enough for them to take the metalwork out. But I remember, unfortunately, when I sort of got wheeled back up to the ward, been in a lot of pain, more pain than what I anticipated. I suppose, obviously, I can't remember the pain that I was really in the first time around because your brain is very clever at sort of making you forget pain. But this pain was horrible, and I just remember I was obviously really sleepy, couldn't really speak to my family. They said I was whispering. They couldn't hear me at all. But the next day, I was still in this immense pain, and what the nurses and one of the healthcare assistants had to do, because I'd sort of slid down my bed, they had to put a sheet under me to try and pull me back up the bed. And that's the first time in my life that I've ever just burst into tears from the pain that I was in. I've never experienced pain like that. And they didn't really know what to do. They were just like, oh God, like what's happened? And I was just saying, what has the surgeon done to me? Like, what is this pain? Like, he's only washed it out. I don't understand why I'm in so much pain. And they didn't know either. One thing I would say is to control my pain relief, they gave me a sort of a button that I'd press. I can't remember how often it was. I had to press it every minute or so to give me some morphine on a tap, basically. But I have to say that wasn't the best thing to do. And if you're ever given that option, if you're going through surgery, don't do it, because where you're so sleepy, not with it, maybe we will have sleep, but I would have to sleep maybe for 20 minutes, and obviously I haven't pressed it for 20 minutes. I'd then wake up and be in more pain. You either need it injected or tablets so that it's constant, the pain relief, rather than every so often. But anyway, so obviously they just washed out the metal and stitched it up basically, as they normally would. And I was given intravenous antibiotics. They gave me sort of a combination because they by then hadn't grown the cultures to find out what sort of type of bug or infection it was. So they were giving me sort of a cocktail of antibiotics, I guess. And this made me feel so ill. Like, I can't even tell you how ill I felt. It's to the point I couldn't sit up, I couldn't walk, because I just felt so dizzy and so sick. And obviously on top of that, hospital food is not great. Another recommendation is try and keep it as simple as possible. So in the morning I'd have Rice Krispies. For lunch and dinner I'd be having jacket potato with beans and cheese, because everything else, it's so disgusting. You can't even imagine. Just keep it simple. They can't really go wrong with a jacket potato. But anyway, I was having to take a lot of anti-sickness tablets, and even sometimes they weren't actually working, so I was having to have the anti-sickness injection, which if you've ever had that, you know how painful it is. They have to push it into your thigh muscle. And for ages after, I still had a lump in my thigh where one of the injections had gone in. Not quite sure why, but that was the only thing that would basically stop me feeling sick. And I think what it was, obviously, where all the intravenous antibiotics was just in my system, and because it was so strong as well, they put me on like a ridiculously high dose. I want to say it was something like just under 2,000 milligrams a day. Of antibiotics, which is quite a lot. But then and I also had to have physio while I was in hospital. The physios were great at what they were doing, but because I felt so sick, I literally could not get up to even walk to the toilet. I remember one time, the last time I had sort of physio, unfortunately, as I stood up, obviously I had a catheter and started walking, the physio actually dropped her radio on the catheter. And then after that, I was like, oh, that obviously caused a lot of pain, and it also made me become sort of irritated. So I thought, right, just get it taken out, and now I'm going to have to get up and walk to the toilet and just force myself to get up. What was quite funny was I was in a ward with a lot of older ladies that were having hip replacements and knee replacements, and they were all up walking and getting discharged before I was. I was in there the first time around about 8 nights, I think it was, which surprised me. I didn't think I'd be in there as long as that. But they basically, I can't actually remember, like I said, it's all a bit of a blur, if they grew the cultures while I was in hospital or if it was after I was discharged. But they basically grew, and it still shocks me now, the cultures as to be E. coli. Now, how on earth do you get E. coli on metalwork in your spine? I just don't know. The two sort of options of how it got there was, like I said in my previous video, most likely at the time of surgery, if something wasn't cleaned properly, or I don't know, something like that, and it was embedded at the time of surgery. So the one good thing, in a way, about E. coli is that it's a really, really slow growing bug. So that's why, potentially, it took 6 years to appear, because of it obviously being E. coli. Whether that's a good thing or a bad thing, I would take that as a good thing, because I did have 6 years without any issues. But it also makes me worry that, say if there is still E. coli on my spine, is it going to take another 6 years to show itself, which will mean I will be nearly 30. And to go through that at 30, like, or at any age, you don't want to do it. But anyway, that's what they grew. So they were then able to obviously treat me with the correct antibiotic, and I can't remember the name of it, sorry. And I was, like I said, I was discharged after about 8 days, and everything was looking really good. I still felt sick. I was still having to take anti-sickness tablets, and I still had this really severe pain if I was sitting or standing for too long. I remember sort of a day or two after I was discharged trying to sit up and have dinner, and being in so much pain I was sweating and had to go and lie down for 5 minutes, then come back and then try and eat my dinner and lie down again for 5 minutes. That lasted a couple of weeks until it got to a point where it wasn't unbearable anymore. Obviously I just spent most of the time laying down either in my bed or on a sofa. I think I was off work for about 2 weeks from that surgery. But unfortunately, what happened literally the day after I got home, because they gave me obviously just big bandages, like big white plasters for my back, sort of to just protect the stitching. Literally the day after I was discharged, I noticed that there was a spot of blood on the plaster. It was about the size of a penny, and I remember thinking, why is blood coming out? You know, it's been by then about 9 or 10 days since the operation, and I hadn't done anything strenuous. You know, I'd been laying down, hadn't gone back to work yet, and I just thought, oh, I don't like the look of this. And I remember my parents saying, you know, as long as it's not green or pussy, it'll be okay. And then the next day, you guessed it, more pus started coming out, and actually it was more green liquid, sorry it's so disgusting, than actually before my surgery. And I remember ringing up the bone infection clinic. I had a lady called Chin sort of on speed dial and saying, oh, it's come back, it hasn't worked. And I remember her saying, right, you need to come in and we need to have a look at it, which I did. And they sort of said, right, well, leave it for the time being. You're on the antibiotics. It may clear it up. Just give it a chance. And I think at that time as well, they were taking my stitches out, which, by the way, really doesn't hurt. I was really scared, and it does not hurt. And they said, sort of, we'll leave it. But anyway, what I'm going to do, and I have figured out how to attach a video of photos at the end of this video, so you'll be able to see exactly what I'm talking about, because I literally documented everything. So yeah, they took the stitches out, and I think, I can't remember if that was the day that they sort of said to me, okay, we are going to have to do another surgery, this hasn't worked, or if it was the time after, I can't really remember. Whichever day it was actually my first day going back to work. And I remember walking back into my office for the first time in like 3.5 weeks, and everyone been so pleased to see me, and I just burst into tears and said, oh, I've got to go through it all again. My team were so supportive. They were the best team ever. They really understood what I was going through, and the management were great. They made me not have to like sort of worry about work and what was going on, and just focus on myself. But anyway, I went back to work for about 2 weeks. I don't know how I did any work because I was just so worried about what was going to happen next. And I had to be admitted again at the beginning of September. And what they basically said this time, Mr. Bagawati was really sort of upset and annoyed at himself, because what he was going to do originally in first surgery was fit what they call a vac pump into the wound, which is basically, rather than your typical sort of stitching which forces a scar together or an incision together, a vac pump is like a black sponge that they actually embed into the wound, which promotes healing from the inside out, so it sort of closes it up that way rather than forcing sort of the two bits of skin and tissue and whatever to be stuck together. That also draws out any fluid, infection, anything that needs to come out will basically get drawn out. And he sort of kicked himself, and because he was originally going to do that in the first surgery, but at the time of the surgery they didn't think it was bad enough to need that, so that was why they didn't do that. And you know, it's one of those things, doctors are only human at the end of the day. I wasn't annoyed about it. It was just like, right, okay, next step, let's get this done, and hopefully this time it will work. So anyway, I was admitted again beginning of September, and this time I was on ward 4, again at the Royal National Orthopaedic in Stanmore, and this ward was a lot newer, which made me feel sort of more comfortable in a way. I don't know why, it just didn't look as scary and as dingy as the other one. And what was quite nice, I was next to a window. A couple of times I was looking out the window thinking, okay, I'm going to jump out of here and escape, but that was nice to have, rather than just feeling sort of like in a prison almost. This ward was a lot smaller as well. I was in a room with about 4 other women, which was better than obviously being in a room full of, I think it was like maybe 20 people. But anyway, this time what they did, they went back in, washed it all again, but this time they actually did remove part of the metalwork. So the sinus tract, as they call it, which was like the tunnel of infection, went down to one of the screws where the crosslink was, and the crosslink is what holds the 2 rods together. And you'll see from the photos of my x-rays what I'm talking about, right at the top where the lump was. So it made sense for them to just think, right, we're going to remove this, because this probably is the part that's got the infection on it. And knowing that obviously it was E. coli by then, that hopefully it hadn't spread further down the rods. So by doing that as well, they were actually able to get a lot deeper into the tissue underneath that they couldn't reach before. And apparently there was a lot more infected tissue underneath. And by removing the crosslink as well, they knew that that wouldn't cause any issues. My surgeon actually said, which is quite a scary thought, that he was able to pick me up by the metalwork on my spine, and it just was so solid and so fixed that they didn't have to worry about removing part of the metalwork. They knew that everything had been sort of cemented in place basically. And then, like I say, this time they fitted the vac pump, and I remember coming round and in my ward and thinking, oh, what's that red wire for? Not realising that it was actually the tube coming from the vac pump into a canister at the bottom of my hospital bed that was actually sucking out liquid and blood and all sorts. It was disgusting. But obviously I then knew that it was doing the trick. It was getting out any sort of fluid and so on that they needed it to. This time around I wasn't in pain like I was the first surgery. I don't know why that is, because you'd think that it was maybe more invasive and it would hurt more, but it didn't. But I still felt really, really sick. And obviously I was on, again, intravenous antibiotics. I hadn't had a break in antibiotics since the beginning of August, so obviously I'd been on antibiotics for at least 4 weeks by then. But it was the intravenous that seemed to make me really feel really sick. What I sort of noticed was, if they'd done my intravenous antibiotics at 6 o'clock in the morning, I'd feel really sick and then wouldn't be able to eat my breakfast, and then felt even more sick because then I hadn't eaten. But what I found was, say, they were busy that morning and they didn't actually give me my antibiotics until after I'd eaten, I felt fine, which is weird because obviously it's not like an oral tablet that you're taking is going into your stomach, it's going into your bloodstream, so it's not like having a full stomach. I don't know if it would make a difference or not. But anyway, that's what I asked them to do. I said, please can I have my intravenous in the morning after I've eaten my breakfast? And by doing that, I didn't feel sick anymore. Still couldn't really eat their food. What we started doing, luckily for me at the time, not luckily for Harry, he had just graduated and didn't have a job. He was still looking for a job, bless him. So he was actually able to come up every single day in August and then the time again in September, and see me every day, and so did my mum. My mum would bring me up homemade soups and sandwiches, just anything she could, and Harry and I would actually order takeaways to the ward. They were absolutely fine about it. He would go and collect it from the car park and bring in a plain curry or like chicken, pizza, and it made me feel a lot better just eating food that I actually enjoyed, rather than looking at the menu of the hospital and thinking, oh, I can't bear to look at anything on this menu. That I think actually really helped me feel more myself again. But anyway, after that surgery in September, I was always told that a few days later they would take me again down to theatre again for the 3rd time, and what they were going to do is stitch up, as they called it, the deepest level where the metalwork in my spine was exposed, I guess. I don't really know. They stitched that bit up and then again put the vac pump on top of that. And that was all fine. That was really quick and simple. What actually quite scared me that time was when I went into the room to have the anaesthetic, for some reason I started having a bit of a weird reaction, and even though I was 22 at the time, I'm still such a wimp and a baby. My mum was actually allowed to come with me each time into the anaesthetic room because she just insisted, and I think by the end of it was sick of her, so they said, yeah, okay, just come down. And that time I started getting like a really rash. I could feel it. I could feel myself getting all hot and really itchy, and that really panicked me. But apparently it's quite common, so if that does happen to you, don't worry, basically. But obviously before I knew it, I was asleep anyway, so I didn't have time to really worry about it. But yeah, so then the second time again, just washed it, vac pump, and then I was back out on my ward. This time around, I was actually in hospital for about 14 or 15 nights. Can't remember, a lot longer, because obviously they were waiting for the vac pump to start doing what they call granulation, which is where like I said, the inside of the wound starts healing. And once they were happy with the granulation and they knew that it would basically continue to sort of build outwards, that I would be discharged. One very annoying thing though at the time was that they were saying that I needed a PICC line fitted. For those of you who don't know what a PICC line is, sun in my eyes, it's basically I don't know, like a really, really thin tube that they put into about here of your arm. They thread it through your main artery and it sort of goes into your heart somewhere, where they can basically long term give you intravenous antibiotics, because obviously you can't have cannulas all the time. They only last about, I don't know, 3 days maybe. And because what they were saying is I would need about 3 months worth of antibiotics. This actually scared me more than the surgeries. I don't know why. I just hate the thought of it going into obviously a main artery, getting threaded into my heart, and also you have to be awake for this procedure. They have to take you down into theatre, and I just was petrified. And I remember asking the bone infection clinic, do I definitely have to have this? Can it not be treated orally? Because at one time they were saying, oh yeah, oral tablets are basically, it's been found that they treat infections just as well as the intravenous. But anyway, they were adamant. They were like, no, 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 you have to have this done. And even my mum queried it. She was like, look, she's petrified. Does she really have to have this? And they insisted. So it was a really weird experience. And I have to say, if you do have to have one fitted, it isn't actually as bad as sort of, I guess, you make up in your mind. What felt really weird was obviously laying in theatre wide awake, and it just felt like I should be asleep in here. I shouldn't know what's going on. And what was quite hard, they had to move you from your hospital bed onto like a board, and obviously been in pain and everything, been a bit tender, that wasn't very nice to have to be lifted, because I suppose normally you're asleep when that happens, so you don't feel it. And anyway, you can kind of see it on a screen what they're doing. They have it, it's like almost like a CT or ultrasound, I think it was, of what's going on, or an X-ray, I don't know. But it's live, so you can actually see it on the screen. I couldn't watch because I just felt really squeamish. But what they do, they inject your arm first of all with local anaesthetic, and he said to me, oh yeah, it's going to sting for about 30 seconds. I counted and it was well over a minute. So just to warn you, it isn't 30 seconds, and it is obviously a really sharp sting. He said it's like a bee sting. I've been stung plenty of times by bees. It doesn't feel like a bee sting. It does hurt, but then obviously after that everything goes numb. You can sort of feel, I don't know how to describe it, the threads, I guess, going through. And he did warn me before. He's like, if you feel any scratching, let me know. And I did. I feel like halfway I sort of felt something scratch, and I said, all right, yeah, I feel that. And that panicked me, but all he said was it basically just means he needs to put more local anaesthetics. Obviously then I had to have more, which stung even more. But then I suppose it was done in literally minutes, maybe 10 minutes, that's all it was. And then they took me back up to the ward. They strapped it, because obviously you've got this kind of like dangly cannula just poking out your arm. It's quite weird to see, and the hole is actually quite big, which surprised me. It just makes me feel a bit weird even thinking about it. Anyway, so obviously then they started administering the antibiotics through this instead. But then the next day, I can't remember who it was, if it was someone from the bone infection clinic or a nurse or the surgeon, I really can't remember. Someone came to ask me of, oh, who's going to administer your antibiotics when you go home? And I was like, well, a district nurse? I don't know. Like, what is the procedure? And they said, well, can't your mum do it? And I just thought, there is absolutely no way. I know my mum, she will not want to do this. And I remember phoning her and asking and saying, the doctors are asking, can you do this for me at home? And my mum just said, no, like, I don't know what I'm doing. You know, I'm not a doctor. I don't know what it is that I have to do. Because you have to, it's not as straightforward as it sounds of just, oh, like, pump it in. You have to mix it with like different solutions or something. I don't know. And my mum sort of said, you know, at the end of the day, she doesn't want that responsibility of, in case it goes wrong. She'd rather a district nurse come and do it. And obviously I felt the same. My mum is a bit squeamish when it comes to things like that as well. So I just sort of replied to them, well, no, like, my mum doesn't want to do it. I haven't got anyone at home that is able to do that. So then they came and told me, oh, we're removing your PICC line. We've decided that you can actually take oral tablets instead. And this, literally, I went mad. I remember saying to the surgeon when he came to see me, are you only doing this because my mum won't do it? Like, you've put me through having the PICC line, which I asked and asked and asked, does it have to be done? And anyway, they just said, oh no, we've just decided that actually these oral tablets will be better. But I still think now it was because we weren't going to administer the antibiotics at home ourselves. So then I had to go through the ordeal of having it taken out, which, again, I was just the biggest baby ever, really scared. I think I had the surgeon in there, about 3 nurses, and my mum. Each person was either stroking my head, my leg, my arm, and just trying to calm me down. But actually afterwards I felt like the biggest idiot ever, because they literally pulled it out within, I don't know, 10 seconds. Really stupid. Afterwards I just felt really silly. So again, if you're going through a PICC line, take it from me, who's the biggest baby ever. It's absolutely fine. You have absolutely nothing to worry about. But then after that ordeal, I then was discharged. Like I said, it was about 14 nights or 15 nights that I was in there. And I went home with this vac pump One thing to know, this vac pump makes really, really unfortunate noises. It sounds like you're constantly farting. And they give it to you in this little black bag that you can put over your shoulder. So one time I had to go to the dentist while I still had the vac pump, and I was sitting in this really busy waiting room, and there were some kids in there, and I know they were just laughing at me, thinking it was me that was actually making the noises. So just to warn you, don't go out in public if you're easily embarrassed like I am. And then sort of after a week or so, I think it was, because I was really hoping to go to Belfast at the beginning of October, and wasn't sure if I could fly with the vac pump, and obviously with everything that was going on. So it was like a goal to get the vac pump removed, because each night they have to change it basically. They have to, because it's a black sponge, they have to cut it to fit basically into your open wound. So they changed it once for me in hospital, and I remember them bringing up a great big canister of gas in there, and I remember thinking, oh my god, is this going to really hurt? But it doesn't. By the time it stung a little, the new one was in anyway, and then the pain was gone. So they said, okay, that's good, like we know now you can definitely go home, and district nurses who were going to come anyway were going to be able to do that at home. This also just reminds me of, basically, always be so vigilant of what nurse is coming into your house and what they are doing, and even in hospital, you know, with cleanliness and anything like that. Because unfortunately I had one district nurse that came round to change my vac pump for me, and she was supposed to be a experienced nurse. I think she'd sort of been there for several years and been changing vac pumps for years. And I remember when she came in, she just was a bit sort of ditzy, nothing really wrong with that, and she sort of asked me, oh, do you have any scissors? So, you know, I can open these packets. And I just thought, oh, okay, yeah, let me go and get some. And I literally just went and grabbed like the nearest scissors I could find, which were just our kitchen scissors that we have. And obviously I've got my back to her because she's working on my back, and I'm sitting on sort of the dining room chair, and I can hear this snipping, and I'm thinking, what is she cutting? Like, that sounds like she's cutting the sponge, surely not. And I turn round, and she's cutting the vac pump sponge that's about to go into my bag with my kitchen scissors that we use to cut bacon and, you know, whatever you use your kitchen scissors for, like absolutely anything. And I remember saying, oh, hang on, they're just out of the kitchen, like, are they okay to use? Like, are they clean? And she sort of went, oh, I have cleaned them with saline. And then before I knew it, anyway, she put it in. And I remember thinking, oh my God, like, the whole reason I'm in this situation is because of infection. And she knows that. She's got all my background. And I just remember thinking, oh my God, what if she causes another infection? And then anyway, obviously by then, I don't know, I was just stunned. And by then it was too late. She'd put it in. And I remember when my mum came in and like came home, I said to her, Mum, like, this woman's just done this. And honestly, I don't think I've ever seen my mum so angry in my whole life. She just went absolutely berserk. I actually felt sorry for the nurse, which I know is silly because obviously she's put me at risk, because she was just so annoyed. But understandably, because obviously I've just been through all of this. I've had 3 surgeries in literally 4 weeks, and all to do with infection. And my mum basically just, went mad. But thankfully, nothing happened. I didn't get any secondary infections or anything like that. I think they came the next day. Another nurse came and changed it for me to get it out, basically. But anyway, then they moved on to the the Pico, as it's called. I did have this also in August. When there was pus starting to come out, they put a Pico on it, which is again like a small sort of machinery. So the box is only about this big, of like a little tube that again draws out any liquid and fluid. They put that on, like I say, in August, when they were hoping that they wouldn't have to do another surgery, but obviously they did. So after the vac pump basically had done its job and the wound was sort of shallow enough and sort of healed enough to then change it to a Pico, they did that, which also then meant I was able to go to Belfast for Harry's sister's birthday, which is really good. And the Pico again does the same job of drawing out any liquid or fluid infection and so on. And again, you'll see from the photos that I attach again at the end of this video, sort of the different stages of it. You'll see how smaller the wound gets each time that I take a photo, and it is really amazing to see. And then it basically just got to a point where I didn't need the Pico anymore. I just needed a normal dressing, waiting for it to just completely heal. So it was a long process, and you know, the sort of technologies that they have now, like this back pump, just was amazing. I couldn't believe what it was doing. Like you'd see in the canister, like when it needed changing, it was quite gross to think, oh, that's come from inside me. But knowing that it's done its job and healed me, it was just amazing. Obviously, all this time as well, I've been on antibiotics. Like I said, it was so strong. I think it was like 2,000 milligrams a day. So I never really felt very well in myself. I felt sick quite a lot. But I didn't feel myself for a long time anyway. Obviously, before the surgery, when it all first came about, like I said in my previous video, because it was leaking green pus, I did feel really down. I didn't feel myself for a really long time. And I just think my boyfriend, Harry, bless him, he was so good at supporting me and just completely understanding that I just felt rubbish and really low. And it's just so important. It does highlight how important friends, family, and whoever's close to you, how important those people are, because they actually get you through like the toughest situations ever. But again, I always remind myself, okay, this has happened and it's unfortunate. I'm still so lucky with everything I've gone through. I just think I'm not in pain, and touch wood, and this is kind of why I haven't wanted to do the video, I've been okay. I haven't had any signs of infection, no more lumps. The wound has healed up quite nicely actually. Apparently it's still supposed to shrink and get smaller. It looks fine. I mean, it isn't obviously as nice, I don't know if that's the correct word to use, as nice as the other scar I had, which was literally just like a pencil line that basically was skin colour by the time of when I had some of my surgeries last year. This one's kind of a bit like a thicker red scar. It's not as nice, but at the end of the day, it's on my back, it's not on my face. I really can't complain. But yeah, I haven't actually been to Spinal since my surgeries. Well, no, I have been since my surgeries, but not in the last, I don't know, must be 10 months or so, because I just don't feel the need to go. Like, it's a long way for me to go, because I live in Bromley basically, and obviously Stanmore's North London. It is a long way to go, and there's no reason for me to go. I keep delaying my appointment with them. I keep saying, oh yeah, postpone it another 3 months, postpone it another 3 months, because I don't want to waste my time, and I obviously don't want to waste the surgeon's time as well, of them saying, oh okay, yeah, it looks great. Like, there's no way for them to measure it. They did do if I remember, an x-ray after I had the surgeries, and nothing had moved, everything looked the same, and they said, you know, they don't want to have to keep doing scans on me unnecessarily, because it's not good for you really, is it? One thing I sort of have taken into my own hands is measuring my CRP. So if you remember from my first video, the CRP is basically an indicator of infection in your body. And I remember saying to the bone infection doctor, is it worth me having a blood test like every 2 months, every 6 months, just to measure if the CRP is going back up? Because obviously then that's an indicator of the infections come back, because otherwise I'm completely clueless. There was no other symptoms, if you like. So she basically actually said no. She said it's not worth the risk. And I was like, the risk of what? You know, it's a blood test, you know, every now and again. It's not going to hurt. So anyway, I just occasionally go to my doctors. Well, I think I've only done it once actually since, and just requested a CRP, as well as sort of like other blood tests that they check, you know, full blood count and liver function and so on, just to check that my CRP has gone down. Just to give you like a rough idea of sort of how it has changed. I think before the operation, I think about May time 2017, it was about, the indicator was about 19. Normal range is between 0 and 5, and it was 19. Obviously it went through the roof, and I don't actually know the answer to that after the surgery, but that's just because obviously of surgery. And then it dropped again. I think it dropped to about 16, and then it dropped again to 12, and then quite recently in July, that's when I went and had the blood test. It was at 9, which obviously is not still in the normal range. Not quite sure what that is. It could be that I might have had tonsillitis or some other infection at the time, so I will get it tested again in about another 6 months just to see, has it gone down anymore, has it gone back up. But for me, obviously, to compare it to 9 when it was, 19 before, obviously it is an improvement, so hopefully it will continue to go down or just remain the same, and just hopefully nothing else happens. Obviously, if the infection does come back, the next step would be to remove all metalwork, but at the moment, just try not to think about that, just focus on the good things in life instead. Another thing, actually, which, sorry, I did say I'd do this because I do forget a lot of things. Another thing that actually was brought to my attention when I was in hospital after I'd done some bloods was they came and told me, oh, by the way, you have anti-E antibodies. And I'm just like, what is that? And no one actually really explained that to me properly in hospital. They basically said it was nothing to worry about. And when I googled it, I was really confused because it says you can either develop these anti-E, or there's loads of them, I think anti-D, whatever, antibodies from either being pregnant, which I've never been, or from a blood transfusion. And I'm like, well, I've never had a blood transfusion that I know of. So the only explanation is really they may have given me a bit of blood during the surgery, which they didn't disclose. Maybe it was just a really small amount, or they just didn't think it would be necessary to tell me. But anyway, that has now caused me to have anti-E antibodies, which isn't the end of the world. It just means that when I have a baby in the future, I'll have to have regular injections, because it basically, if your baby has a different blood group or something like that, it's a bit too technical for me, you can basically reject the baby. Apparently it's really common. A lady that I work with actually in the moment, she's got anti-D antibodies, and she has to have injections sort of every few weeks. So it's not really anything to be concerned about, but obviously in the event that, if say, God forbid, I was involved in an accident or something, a hospital would need to have it on record that I had anti-E antibodies, so they'd know what blood they would need to give me in the event that I did need a blood transfusion. So this is obviously slightly annoying that this happened to me, because there was absolutely no trace of anti-E antibodies on my bloods before the surgery. So the only explanation is they did potentially give me a bit of blood. But I suppose if I needed it, I needed it. There's nothing I can do about it now. It's just another thing to add to the list. But anyway, I think I've covered everything. Like I say, I will try, hopefully I've figured it out, how to attach the photos. I'll attach photos of the horrible hole, as I described it, in my back, and how that changed over the course of a year, as well as a couple of photos of me in hospital, but also how my scar also healed. There is actually a picture as well, it's not very clear, of the vac pump. I never actually took a picture of it. There's a picture of me holding my niece, and you can see it sort of on the sofa behind me, so pause on that if you want to have a look at it. It's quite big, it's about this big, and it's in a little black bag, like I said, that you can carry over your shoulder. But anyway, I just want to reiterate, obviously this video, the point of this video is just so that if someone in the future goes through something similar or the same as what I've been through, it's just sort of say to them, you're not alone, and maybe also we could give them some sort of idea of what the steps are that they need to take, because like I said in my first video, I'm literally the first person that's ever had this complication from spinal fusion surgery. So the intention of this video is not to scare anyone who's going to have any type of surgery or a spine surgery. I still say, even with this complication, it was the best thing that I've ever done, because I'm not in the pain that I was before the surgery. It just transformed my life. And by now, they basically told me if I didn't have the surgery, I would be in a wheelchair, basically, because it was constricting me. I couldn't breathe properly, and I just think it's all worth it at the end of the day. So if you are sort of thinking about surgery, I do really recommend it, but obviously you've got to make the decision yourself, because at the end of the day, it's your life. But anyway, if you do have any questions or anything you want to ask me at all, like I say, whether it's tomorrow, in a month, years, please just comment and I will get back to you. Thank you very much for watching, everyone.